After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify him using 2 identifiers.
Hi, Mr. Mossman.
Hi.
My name is Cornisha. I'm going to help you change your gown. First, can you please give me your first and last name?
Brian Mossman.
And your birthday?
8/21/59.
Okay.
Before changing a patient's gown, identify any mobility restrictions and check the gown to see if it's wet or soiled.
Okay, I'm going to raise your bed, all right?
All right.
Begin by raising the bed to a comfortable working height and lowering the side rail closest to you. Help the patient assume a comfortable supine position, maintaining his body alignment, and place a bath blanket over him. If necessary, apply clean gloves. Next, remove his gown or pajamas. If the gown has snaps, simply unsnap the sleeves and remove the gown. If the gown does not have snaps and the patient has an injured extremity, reduced mobility, or an IV line, begin removing the gown from the unaffected side first.
I'm going to put your side rail down.
Then remove the gown from the arm with the IV.
Okay. Let's take your gown off.
If an IV pump is present, pause the infusion by pressing the appropriate sensor. Remove the IV and slide the IV container and tubing through the arm of the gown.
All right. I'm going to get it through here.
You may begin dressing the patient in a clean gown starting with the affected side. If an IV pump is being used, repeat the same procedure. And rehang the IV container on the pole. Then restart the fluid infusion by pressing the appropriate sensor. If the IV fluids are infusing by gravity, check the flow rate and, if necessary, adjust it to the prescribed flow rate. Remember, do not disconnect the IV tubing to remove the patient's gown. Check the position and function of any other external devices, such as a brace, an indwelling urinary catheter, or a nasogastric tube. Without touching the soiled gown to your uniform, place the used gown in the linen bag.
Get your back covered up here. Go over to the other side. All right, let's get this side rail down so we can finish putting your gown on. Have you on in here. All right. Tie you on up. Raise your side rail.
Make sure the bed is in the locked and low position, with at least 2 side rails raised. Remove the bath blanket, keeping the linen away from your uniform, and place it in the linen bag.
Just about done. Is there anything else I can get for you?
Be sure the patient is comfortable.
Well, if you think of anything, you can hit this red button with the white cross. We'll get you whatever you need.
Remove your gloves and perform hand hygiene.